Canada's Public Health Agency is giving a new warning to people traveling abroad. It's now telling Canadians to be extra cautious about monkeypox. The agency issued a Level 2 travel health notice yesterday. It's encouraging people to use PPE or personal protection abroad, or consider delaying travel plans until the risk of transmission is lower. Monkeypox outbreaks have been reported in several countries now, outside of the African regions where it's more commonly found. Michael Serapio is on this story for us this morning. Good morning, Michael. So Level 2, not the highest. We have 4 in this country, I believe. But what more can you tell us about this advice?
Well, it does come, Jennifer, as the number of monkeypox cases continues to rise in this country. At last count, at least 100 confirmed cases, the vast majority of which are in Quebec. A much smaller number of cases confirmed in Ontario, Alberta, and British Columbia. But as you suggest, this warning is less about the situation here at home, more about the situation beyond our borders. And fact is, monkeypox is now being detected in dozens of countries outside of West and Central Africa where the disease is endemic. And that's a concern, as monkeypox also appears in areas where it's not been seen before. The Public Health Agency essentially wants Canadians to take more precautions, among them consulting a healthcare professional 6 weeks before any kind of travel, delaying travel when appropriate, isolating if one is presenting symptoms, and avoiding close physical contact with anyone who appears sick. Now, they're also saying to practice respiratory etiquette, things like covering coughs, wearing a face mask, and washing hands frequently. And beyond those measures, be aware, says PHAC, that as other countries deal with the growing spread of monkeypox in their own borders, Canadian travelers who fall ill could find themselves forced to isolate, have limited access to health care, and could even be delayed from returning home. And that's because there are genetic mutations that make this strain, possibly 2 strains of monkeypox, different from what is known in Africa. And as a result, there could be some curveballs ahead. Take a listen to Dr. Samir Gupta.
The warning is there to say, this is evolving. We don't know which countries are going to have more cases. We don't know what necessarily the highest risk populations are going to emerge to be. We think we have a good idea of how it spreads, but again, we have to learn more about that, particularly with this outbreak, whether there are differences with how this spreads and how effectively it spreads compared to what we know of this virus from what we've seen in Africa in the past.
Now, as you say, Jennifer, this is a Level 2 advisory. This is not the highest level, which is a Level 4, so nowhere near the most severe warning level. But monkeypox is a growing concern. There's still much unknown about it, especially the strains being shown in these dozens of countries outside of Africa. So it's something that federal officials want Canadian travelers to be very aware of before leaving our borders.
Canadian travelers awfully familiar with PPE advice, aren't they? Pack those masks. Dr. Gupta saying not a bad idea for COVID still, too. You mentioned the WHO and the spread to non-endemic countries, Michael. So where else has monkeypox now been found?
Well, according to the World Health Organization, it's now been detected in some 27 other countries. In the Americas, that includes the US, Mexico, and Argentina. In Europe, countries like the UK, France, Germany, Ireland, Italy, Austria, Hungary, and Australia as well. So best advice, if you are traveling, go to the Government of Canada website, look for the specific travel advisories issued for the country of your destination. Consider those when you make steps going forward, and be aware as well that in the next hour we are expecting an update from the World Health Organization. So if they say anything further about monkeypox and its spread, of course we'll have that for people at home, Jennifer.
Thank you, Michael.
You're welcome.